Good afternoon and welcome back to Let's Talk Therapy. Do you like the new purple beard? It's something I decided to try because I'm in a phase of trying new things. Today we're going to talk about what's hypnosis and what is hypnotherapy because they are two different things. So, hypnosis is a psychological procedure that can be used to help an individual think about or change how they feel, think about specific issues, and how they act. For example, if somebody has a phobia or if they are on stage hypnosis. During hypnosis, the individual is put into a state of focused concentration that involves becoming less aware of their surroundings. And during this state, they are more able to accept suggestions, also known as interventions, depending on the model you're using. Your therapist will make suggestions that encourage the individual to move away from unhelpful beliefs, unhelpful behaviors, and unhelpful thoughts, and to help them towards more helpful scenarios. For example, if an individual mistakenly believes that they're a bad person, and this is part of their core beliefs, during hypnosis, their therapist will give them suggestions to help them change that to a more reasonable belief that is fine with who they are, that, for instance, they become fine with who they are and more comfortable in their own skin. However, what's hypnotherapy? Well, hypnotherapy is a type of psychological therapy that uses hypnosis to help with certain mental and physical health conditions, such as pain management, anxiety, stress, those sorts of things. It can also be used to help unhelpful habits such as addiction, smoking, picking, alopecia, those types of things. Some therapists also use hypnosis to increase the effectiveness of other psychological treatments and pain management. For example, in birth, when someone's actually having a baby, they will use hypnosis to control the pain. Or during a residential rehabilitation centre for long-term or Class A addictions, such as heroin or alcohol, they will use hypnosis in conjunction with the group therapy and the one-to-one treatment, one-to-one counselling. It's been proven to work incredibly well in conjunction with other treatment modalities. It is also important that within hypnotherapy, some clients are also taught as part of their ongoing treatments to use hypnosis or perform hypnosis on themselves. This is called self-hypnosis. It is actually a very useful skill to teach a client. And as I said, they're often taught, a lot of my clients, I'll teach them self-hypnosis. And they find that once they've actually been through a hypnosis session, they realise the benefit of it, so they want to learn it themselves. And it helps them with long-term anxiety management, stress management, if their circumstances in their life change or they find themselves going back to old beliefs or old behaviours. It's also very useful within addiction, as I said, self-hypnosis to help relapse prevention. It's very good. Now, if you wanted to go down the road of hypnosis, there are a lot of apps people can use and hypnotic procedures available, or you can download from our website, Trances, if you find that helpful. And the good app is called Headspace. And they're also well known as meditation apps as well. Okay, I hope you find this useful, and I look forward to speaking to you again soon on the next podcast.